The impact of prenatal substance exposure does not end when a child leaves the hospital.
The statistics say that 1 out of 10 children have been exposed to substances.
And that's why Hope Rising Clinic is here.
Preston was born with methadone in his system. It was pretty early on that I started to see symptoms that things were a little different. He had a really hard time being consoled or sleeping. He had problems feeding, and having to deal with my own substance use disorder on top of his stuff is really difficult, really challenging. The Hope Rising Clinic was available to take us in, and we started receiving services right after.
Hope Rising Clinic was kind of this idea of a program that came out of Wonderland's early support program.
We created a business plan, did a lot of research, reached out all over the world for trainings and information, discovered that there were no comprehensive facilities that we could find at the time. And the reason is the work is very time and trauma intensive and very expensive to support.
It's nothing like an outpatient clinic visit. It's really far more intensive and supportive than that.
We have a saying that the only thing that's consistent is inconsistencies with our kids. So every day is different. We provide a lot of extra support, not just to the kids, but to their families.
Having a child with PSE can be very isolating. And when I started coming here, that's when things really started to click. And I was able to build these skills that were really useful and were really beneficial for both of us.
There is a lot of stigma about prenatal substance exposure in the community. It had been really hard to get people interested in the work that we were doing because of that stigma. But Premera really understood, and they got it, and they really wanted to support.
They believed in the idea without the skepticism or the stigma that we experienced with smaller funders.
That allowed us to get the clinic started, to train our staff, and to get those first couple of years under our belts.
There are so many children and families who are waiting for these specialized services.
It's the only place that is available.
We haven't even begun to advertise, and we still have a waiting list. It keeps a lot of us up at night, that we can't serve all the children who need our services, let alone the ones who haven't even heard about it yet.
These kids didn't have a choice in how they were born or where they were born, how their childhood was, but we can have a choice in how we support them.
If we can create these early intervention services, it will have such an impact, on families, on kids, on society at large.